Hello and welcome. Today we'll be exploring a complex and somewhat controversial condition, autoimmune Meniere's disease. While the exact role of autoimmunity in Meniere's is still debated, understanding this perspective can offer hope for individuals struggling with this debilitating inner ear disorder. Join us as we delve into the science and explore what it means to live with, and potentially manage, autoimmune Meniere's disease. The exact cause of Meniere's disease, in general, remains elusive. However, the autoimmune theory suggests that in some individuals, the body's immune system mistakenly attacks the inner ear structures. This misdirected immune response can be triggered by a variety of factors, including viral infections, genetic predisposition, or even exposure to certain environmental toxins. When the immune system targets the inner ear, it initiates an inflammatory cascade, leading to the characteristic symptoms of Meniere's. Now, let's talk about what happens inside the inner ear during an autoimmune attack. The endolymphatic sac, a structure crucial for regulating fluid balance in the inner ear, is often the primary target. The immune system's assault causes inflammation and damage, disrupting the delicate balance of endolymph fluid. This fluid imbalance leads to increased pressure within the inner ear, a condition known as endolymphatic hydrops. This hydrops distorts the sensory cells responsible for hearing and balance, causing the episodic symptoms we associate with Meniere's. Determining the precise number of people affected by autoimmune Meniere's is challenging. Meniere's disease itself affects an estimated 1 to 5 out of every 1,000 people. However, the percentage of those cases that are truly autoimmune in origin is still unknown. Research suggests that a subset of Meniere's patients, perhaps those with more severe or rapidly progressing symptoms, may have an underlying autoimmune component. More research is needed to accurately assess the prevalence of autoimmune Meniere's within the broader Meniere's population. The signs and symptoms of autoimmune Meniere's disease are largely the same as those of classic Meniere's. These include recurrent episodes of vertigo, a sensation of spinning that can last from minutes to hours. Tinnitus, or ringing in the ears, is another common symptom, often fluctuating in intensity. Hearing loss, typically low frequency at first, tends to worsen over time. Many individuals also experience a feeling of fullness or pressure in the affected ear. In autoimmune cases, symptoms may progress more rapidly or affect both ears simultaneously, although this is not always the case. Diagnosing autoimmune Meniere's disease can be difficult, as there's no single definitive test. The diagnosis relies heavily on clinical assessment and ruling out other potential causes. Standard diagnostic procedures for Meniere's, such as hearing tests, audiometry, and balance tests, electronic-stigmography or ENG, are essential. However, suspecting an autoimmune component often requires additional investigations. Blood tests may be ordered to look for specific autoantibodies associated with autoimmune disorders. Response to immunosuppressant medications can also be a helpful diagnostic indicator. While Meniere's disease isn't strictly classified into different types, it is important to note that autoimmunity can contribute to the severity and progression of the disease. In essence, autoimmune Meniere's can be viewed as a subtype or a contributing factor in some cases of Meniere's. Rather than a completely separate entity, it's crucial to differentiate between idiopathic Meniere's, where the cause is unknown, and cases where autoimmunity may be a significant driving force. Treatment for autoimmune Meniere's focuses on managing symptoms and suppressing the underlying autoimmune response. This often involves a combination of approaches. Medications to control vertigo and nausea, such as antihistamines and antiemetics, are used during acute attacks. Dietary modifications like limiting sodium intake can help reduce fluid retention in the inner ear. For autoimmune-related inflammation, corticosteroids, either oral or injected directly into the ear, may be prescribed. In more severe cases, immunosuppressant drugs like methotrexate or azathioprine may be considered to dampen the immune system's activity. Vestibular rehabilitation therapy can help improve balance and reduce the severity of vertigo episodes. In rare and severe cases, surgical options like endolymphatic sac decompression or vestibular nerve section may be considered as a last resort. However, these are not specific to autoimmune cases and carry their own risks and benefits. Currently, there are no proven methods to specifically prevent autoimmune Meniere's disease. Given the complex interplay of genetic and environmental factors, prevention remains a challenge. However, maintaining a healthy lifestyle, managing stress, and avoiding exposure to potential triggers like certain infections or environmental toxins may potentially reduce the risk, although further research is needed in this area. The prognosis for autoimmune Meniere's disease varies depending on the individual and the severity of their condition. Some individuals experience periods of remission, while others have more persistent symptoms. Early diagnosis and aggressive treatment to control the autoimmune response may help slow the progression of hearing loss and reduce the frequency and severity of vertigo attacks. Recent research is exploring the potential of novel therapies that specifically target the immune system in the inner ear. For example, targeted therapies that block specific immune cells or inflammatory molecules are being investigated. The ongoing research offers hope for improved treatment strategies and a better quality of life for individuals living with autoimmune Meniere's disease. Remember to consult with your healthcare provider for any medical concerns or before making any decisions about your health or treatment.